Hello everyone. Today we are going to chat to Bailey Cockerill. She's a biokineticist and she operates in Rondebosch and occasionally in C.2. And we've got some really amazing questions for her today about exercise, the body, how to keep it healthy, and we are going to hand over to her straight away so she can let us know a bit more about herself.
Thanks so much for having me today. It's wonderful to have the opportunity. So, I'm a biokineticist. I have been since 2008, so it feels like a very long time. I currently serve as the Public Relations Director for the Biokineticist Association as well. I'm a wife and a mother to two gorgeous little kids who've just recently turned 5 and 2, and they definitely keep me on my toes and have taught me so much about myself in this sort of parenting journey. And it's been great to have that experience of trying to balance family life and just getting a whole picture of what we can do as practitioners, parents, mothers, women. So that's really me. I've got a special interest in women's and pelvic health. I started off in chronic disease management many years ago, went into sports and orthopaedics. That has always been quite a passion, but then that opened the doors to getting involved with the pre and postnatal population and really focusing in on pelvic and women's health, which is still something that I'm learning much about.
Amazing. Okay, so let's chat about the concept of prevention being better than cure and how we can help ourselves stay healthy through movement.
So when prevention is better than cure, the phrase comes up, it always makes me think about the narrative of healthcare has always really focused on lifespan and having this long, lengthy life. But I think we need to shift the focus to health span as well in terms of your quality of life. There's no point in having this long, lengthy 80, 90 plus years of living if we don't have good quality of life. And I've always subscribed to the prevention being better than cure concept, because if we can stop things from, we'll avoid things from being damaging and costly and nipping things in the bud before they become a long-term issue, then why not? It's going to help us overcome certain barriers. It's going to make us maintain our... there's a bit of noise going on in the background, I'm sorry. Prevention being better than cure, we want to just nip things in the bud to make sure that we can be more committed to what we're doing. Because if there's multiple barriers to trying to get things done, it's going to be really difficult to stay dedicated to our healthcare interventions. It makes me think about a professor that I had at university who always said that exercise is the polypill, but no one really likes the prescription, adherence to the prescription, because it's hard. It's hard to actually, stay committed to doing exercise, but it's something that you have to do. You actually have to make the choice to do that exercise. It's not just as simple as slipping back a pill and being like, I've done my duty. It takes commitment. I think if we can prevent things as opposed to trying to just treating symptomatic issues, let's be proactive in our lifestyle choices that will set us up for success.
Absolutely. It's especially hard in winter to stay committed.
Absolutely. I had this thought this morning. My alarm went off and I thought, it's so dark, it's so cold, my bed is so wonderful. And at the moment, but I feel so much better for it. So try and think about
it's just
the effect
an hour and then you're done.
Get it done.
Okay, let's chat about pregnancy and exercise. Apparently, only 15% stay active during pregnancy, which is really low. Can you unpack that? And what is the benchmark? Why is it important to stay active? And what should be also at the same time taken into consideration?
So I think fortunately those stats are starting to change as there's more research being published and more women coming into science and having a voice for this population that's been largely neglected over the years. And also depending on where, what country you're in and those sorts of things. But yes, there has been an avoidance to exercise during pregnancy because it was considered dangerous. But we're now realizing, and have for quite some time realized, the benefit of exercise during pregnancy, not only for mom, but for baby too. It, obviously helps you helps you with the continual adaptations during pregnancy. You go through so many physical changes during pregnancy so using exercise as a modality to help you adjust to that is hugely important. It helps you prepare for childbirth. It helps you prepare for postpartum. it helps prepare you for the parenting journey as well, because this chapter in a woman's life is honestly the sort of, I think it's the ultimate human race. Everyone talks about comrades being the ultimate human race, but I think being a mom and going through pregnancy and childbirth and postpartum recovery and parenting is the ultimate human race. And particularly from a pregnancy point of view, your body is going through the absolute maximal physiological adaptations that a human body can actually ever endure. So, exercise just helps you with that resilience, helps prevent things from becoming a problem later on. And yeah, it's so helpful to you and the baby. Some research is showing that there's even genetic impact on the fetus when you do sufficient exercise during your pregnancy to reduce, non-communicable diseases like your diabetes, your cancers, those sorts of things. So you're setting up your future generations for success too if you are able to get sufficient exercise in during your pregnancy. But I think, yes, people have always feared it because they don't know what to do, how to do it. Is it going to harm the baby? The current recommendation for the prenatal population is trying to accumulate about 150 minutes of moderately intense exercise throughout the week. So if you can split that up into, 15-minute sessions or 30-minute sessions, it needs to be of a decent amount of intensity. Otherwise, it's not going to create physiological adaptation. But you also don't want to be pushing, things too far out of the boat, because we do have two very important lives that are being taken care of. It is quite, if you're not used to exercise and you've been recommended by a healthcare professional that you should be doing some exercise during the pregnancy, I would highly recommend that you chat to someone like a biokineticist or adequately trained individual who can prescribe exercise to the special population, just to be a guide and to hold you accountable and keep you going, because it can be very scary. You don't want to do something that you think may harm you. Just help remind you of some of the sort of red flags and the markers and the absolute and contraindications to exercise. Having that support network around you with the knowledge and the skill set to keep you going is what we need to lean into that.
Yeah, I think a lot of people don't realize there's so many modifications to particular exercises where certain parts of the body are protected a lot more if you're modifying them. So
Absolutely.
if you are having specific problems,
minor adjustments and tweaks that can help you through the various trimesters. So it doesn't have to be so overwhelming. But I think most important is to just maintain some consistent level of movement. And it doesn't have to be in the gym. It doesn't have to be, a scheduled exercise class. Going for a walk is great. Doing some gardening, whatever exercise is going to keep you going, what is going to, you're going to be feeling enticed to continue with that exercise is going to be the best exercise for you. And if you don't know what that is, then reach out to someone who can open up the door of opportunities to that. I think just maybe to add on to that, it's we're speaking specifically about the pregnant population, but there's been a lot of chat in the industry recently about, for the first time ever in 2025, we've had the very first postpartum return to physical activity guidelines published. And I think it's just insane that in 2025, it is the first time we're having an actual guideline for women to kind of adhere to say, like, this is what you could be doing. And it takes this beautiful sort of biopsychosocial approach of, sure, you have your 6-week checkup, and usually that's when people say, okay, you can get straight back into exercise. But there's so much more than just the tissue healing. The emotional adaptation, the lack of sleep, the support network. This absolutely. So it's so nice to see that the narrative around all this is changing, and that there's empirical evidence supporting it now from a scientific point of view, so that women are feeling more supported and have more knowledge and then can be more empowered with what they can do for themselves, especially in those early stages of postpartum. So we get so much attention during the prenatal phase, but are kind of left our own in the postpartum phase, and that's when we need the help the most. Of course, it's scary and overwhelming. When, particularly if you're going through your first pregnancy, it's quite exciting and there's so much stuff that you can learn and you go through this massive learning curve. But then you get into the postpartum, it's like, right, you've had the baby, just keep the baby alive and forget about yourself. It's honestly, that's when moms need the support the most. So
absolutely. How would someone obviously their practitioner is going to filter down that information to them from this guide?
Absolutely. So, I mean, it is readily accessible, and I'm very happy to share the guidelines with anybody who wants them. But yeah, it basically suggests that, in especially the early postpartum phase, we start with light, gentle movement as soon as you feel ready to, regardless of what mode of delivery you've had.
Yes.
But obviously, within reason, if you've had quite a traumatic birth experience, then it does suggest that you wait for the proper tissue healing times and those sorts of things. An accumulation of 120 minutes moderate to vigorous physical activity on a weekly basis. Pelvic floor reintroduction. Your pelvic floor's been through so much change, regardless of how you've delivered this baby. You've been creating life for the last 9 months, so your pelvic floor is going to take some strain regardless. Light breath work and stuff to try and get that intrinsic relationship between the diaphragm and the pelvic floor sorted out to maintain intra-abdominal pressure. Easing back into it instead of going from zero to hero, from nothing for 6 weeks to getting back into what you had done pre-baby, which is just so unrealistic. Like, it's we can't expect moms to do that, and that whole sort of bounce back culture needs to be put to bed, because it's impossible, and it feeds into that whole mental well-being too. So let's set up our moms for success instead of just saying, get back to what you were previously, because it's impossible. You have literally on every single cellular, physiological, emotional, spiritual level have changed as a mother. So let's not put additional pressure in by making people feel like they're not worthy.
We're going to hop from that into a more orthopedically related question. In terms of orthopedic interventions, what can you tell us about what you see in your practice to do with this line of injuries and weaknesses?
Sure. So orthopedic, sure. I mean, it was bread and butter of my practice for many, many years, and it's always been a passion of mine to help people with orthopedic and biomechanical issues. And over the years, as I've mentioned, I've had different interests, but orthopedics has always stayed forefront of it. And chronic lower back pain is something that's probably about 60 to 70% of our population is going to experience throughout their lifestyle. And then, even though, it's quite an umbrella term for the multitude of things that can go wrong, whether it's like a sacroiliac joint dysfunction or a disc herniation or a spondylolisthesis or whatever the case may be, come in, someone says, oh, I've got sore back pain. You may have a similar characteristic of pain and discomfort, but each individual is going to have a different reason for it being there. So it's quite important to, assess the individual and see what lifestyle interventions can be provided to suit their needs. So I can have Jane and Joe coming in with the exact same diagnosis, but their treatment plan is going to be completely different. So that's, general population. And, over the years, my practice has really started to go into more pelvic and women's health in the pre and postnatal population. So we see a lot of pubic symphysis dysfunction, diastasis rectus abdominis, what other things? Just the general pregnancy-related pelvic girdle pain, postural imbalances. So I think, as a human, we're going to have some kind of discomfort and dis-ease throughout our lives, just by the nature of being, living in this modern age of technology. There's always going to be something to address. So I think tying back into that prevention being better than cure, if you feel something is kind of off, rather just nip it in the bud. Don't, wait until it is so debilitating that every kind of intervention that you take has no impact. If you can stop something from progressing to like a tertiary level of discomfort, you're going to save your pocket in terms of the cost of intervention, but also just the complete interaction of, you've got a sore back, you can't sleep very well, you're distracted from your work, you're short with the kids, you don't want to, exactly, a compound. So nip it in the bud, try and treat it before it becomes something. I hope that kind of touches on what you wanted to get out of that question.
Yes. How can we prevent sports injuries, especially as we age? What are good rules of thumb, and also what are some red flags?
Sure. So sports injuries, I think, again, just by nature of being physically active, you're always going to have some degree of discomfort. I think, guys that are involved in even just recreational physical activity like to feel something physical in their body. So we get the sort of positive adaptations of, when you go and do some exercise, a couple of days later, you might feel that DOMS, that delayed onset of muscle soreness. And that's a great thing, because it means that our body is adapting to the exercise. There's a a wonderful physiologist from many years ago who coined a term called the general adaptation syndrome. And it tells us about how the body, if you expose a stressor to it, it goes into this initial alarm state and allows for the body to respond to that stressor. So exercise can be considered a stressor. If you continue to expose the body to that stressor, you get to a level of resistance. And in terms of, the physical tissue, that's when we get that adaptation of muscle tissue to become stronger, quicker, whatever the case may be. But if you continue to expose the body to that stressor, then you can go into a state of exhaustion and disrepair and damage. So in terms of what you can do to try and prevent or minimize injuries, I think micro cycles in your training are quite important. So not just doing the same thing all day, every day, week on, week out. You need to train for a bit, have an off week, train for a bit, have an off week, and make sure that you are giving your body the time to rest and recover, because that's actually when it adapts, not when you're doing the physical training. Your body needs that state of rest to allow for it to adapt, and it can only get more resilient during that phase too. So if we're constantly always loading, it's not going to have the opportunity to have those physiological adaptations. So I think training cycles, nutrition obviously is so important to fuel our bodies so that we can do those things appropriately. You can't work with an empty fuel tank, and getting the right nutrition for you in the different life cycles, particularly if I'm thinking about women and pregnancy, postpartum, breastfeeding, menopause. Women are amazing. We go through so many adaptations in our life.
So many.
And then sleep. Sleep is also so important. Without it, the body just can't function optimally. It's when our body recovers, restores, replenishes. So training cycles, nutrition, sleep are so important to try and, maintain health and wellness. Red flags, I think we're very lucky to live in a time where we have so much wearable tech. So we can see if we're not getting good quality sleep. We can see if we are exhausting ourselves with the type of training that we're doing. So rely on those if you have access to that. But if not, listen to your body. I think we get so distracted from what is going on. But if you feel a niggle that's just not right and you haven't really felt it before, but in the bud, prevention better than cure. Let's try and make sure that you set yourself up for success so that you don't create long-term problems.
That's so true. I think a lot of us get so wrapped up with everyday stresses that we don't listen to what our body is very clearly telling us. So let's chat about wellness and wellness strategies as a woman and then as a mother. Maybe chat to us about some of your favorite self-care rituals.
So again, this is something that has changed drastically over the years through my sort of inexperienced years, pre-kids, and then having gone into motherhood and now, trying to balance it all. For me, previously, it has always been about, I've always relied on being physically active to kind of make sure that I try and keep my health and wellness up to date. But especially now, being a mom and juggling it all, I have realized that that's not enough, and I need to focus on things a little bit more holistically, so that that mental well-being is hugely important, probably sometimes more important than the physical aspect of it. But I think, a macro level, in terms of things that I do for myself, I've learned that I need to reach out to other healthcare professionals who've also got incredible skills to supplement my knowledge and, my expertise. So I've, reached out to psychologists and women's health practitioners and nutritionists, whatever it is that needs to, I don't have the skill set for, so I need to rely on their knowledge and expertise to help me see where there are some blind spots in my health journey, my wellness journey. And on a micro level, I like to try, it's not always successful, but try and just at least acknowledge on a daily basis something that I'm doing specifically for me. Because again, as a mom, a wife, a healthcare professional in the therapeutic sense is you're constantly giving to other people all the time. So you're emptying your cup regularly, and it's hard to remember to make sure that you fill up your own cup on a daily basis. If I can at least acknowledge, okay, I'm taking this 5 minutes to do a meditation for me so that I can do the rest of the things, and ensuring that I schedule that social interaction with some friends to get the social element sorted out, which helps with the mental well-being. And if I'm in a good headspace, and I'm going to want to try and exercise a little bit more. So there's such an interplay between all of it. And even though, I come from a very physical movement-based background, I can absolutely see the importance of making sure that the other facets of being this human being need to be met too. Otherwise, it's not enough. And I think for a long time, personally, I tried to force that exercise because I wasn't feeling good. It's because I wasn't exercising and I was trying to do more exercise and it wasn't giving me the results that it had previously. And I realized that I had exhausted that. I needed to look at other elements of what it means to be a human and tap into those aspects of health and wellness too.
It's so true because everything changes all the time too. And I think achieving some kind of balance between all of them is the most you can strive for.
And it's so hard, isn't it? Especially if you are sort
so
of like
hard.
a bit of a perfectionist, or you don't like change. Oh, listen, I'm all there. It just feels, it can be really, really tough. And I think to surround yourself with people who are going through a similar thing is quite important as well, because it makes you feel like, okay, this is normal. It does make you feel a lot more supported and human.
Can you tell us a bit more about the importance of posture and gait? I saw such an interesting post you had a short while ago, actually, about posture and gait. And I thought, a gait is the way that you walk. Is that right?
Yes,
posture.
It is.
And then how does this affect quality of life? I can understand posture, but gait I was a bit thrown about.
So I think, at a foundational level, our body has been designed to work in a certain way. And, even the little nooks and crannies and the bumps and the ridges in our skeleton all have a purpose. And, if we can keep our body aligned posturally and have good gait, it allows our system to be as efficient as possible. It prevents things from becoming a problem later on in terms of discomfort, disease, injury, those sorts of things. But by nature of the kind of lives that we live these days, it's hard to maintain that anatomical structure that we have been born with. We're stuck behind desks all day, we're carrying kids, slouched behind the computer. So our body is going to adapt, and our bodies are compensating and do what we ask of it on a daily basis. But eventually that can potentially lead to pain, injury, discomfort, disease. So I think that in my practice, I like to work with trying to maintain a good foundation of support. So if you think about a house, if you don't have a good foundational support in your house, it's going to come collapsing and crumbling down. And it's no different to our human bodies. Let's, try and maintain that foundation of support as much as we possibly can, keep things working efficiently so we can perform better, that we can have, better output and outcomes in our daily lives. Just really focusing on getting good quality control from within, I think is hugely beneficial in terms of not adding to the other stresses that we have. Because if we, it's just that last little straw that can break the camel's back sometimes. So again, feeds into prevention being better than cure. Let's set ourselves up for success.
Actually, this goes into the next question because we talk about movement and spine. Are there any stats that you might know about spinal problems, especially as we grow older? How important is the spine in relation to aging and being mobile? And how do we, I think you've touched on this already too, how can we show our spine care?
So I think our spine is so vitally important to our general being, because not only is it an anchor point for a whole host of tissue structures, it houses the central nervous system in terms of the spinal column, which sends all that information out into the body in terms of what our limbs and our organs and everything should be doing. We need to show our spine some love, and there's an entire industry around chiropractics that can help you with supporting spinal health. And I think, over years, there's going to be wear and tear throughout these systems, but you can be predisposed to degenerative disc disease, spinal stenosis, arthritis, those sorts of things. If we are not aligning things properly, if our body's been in the state of compensation for too long because of the way that we have been living our lives. And I think that if we can move our bodies appropriately, try and maintain mobility through the vertebral column in the different segments, because we have so many different segments. We've got the cervical region, thoracic, lumbar, sacral, and each area of your spine has got a certain functionality. We want to maintain stability in one area and a bit of mobility in the other so that everything else can work properly. But usually we see this paradoxical thing happening. So I think if we don't show our spine some love, it's going to again impact that quality of life and that health span. The interesting thing, if you just look at the anatomy of your disc space, so your spine is a whole bunch of vertebral columns stacked on top of one another, and in between each vertebral segment you have this cushioning or a disc. It's called the annulus fibrosus and the nucleus pulposus, and it's this very gelatinous fibrocartilaginous structure that is made up of collagen and is very hydrophilic, so it draws in water. But there's no actual nutrients supplied directly to it. It relies heavily on movement to create a pump to get nutrients into that space. So if we're not moving the body, you're not getting nutrients into those space, the functionality of that tissue structure is diminished. So we need to make sure that we're moving and feeding and fueling all of those areas too, instead of just staying rigid.
Wow,
Honestly, the human body is fascinating. It is so beautifully designed, and I think if we had better knowledge of these things, we'd be like, okay, well, my exercise is to sort of supplement the health of my disc space now. And, if you can maintain good disc health, then it's going to help prevent degenerative problems. It'll help, disperse the forces that go through that area so that the skeletal structure itself stays healthier. And I mean, this is all, I'm sure if you spoke to a chiro, they would give you much more information about those sorts of things. But yeah, it's, again, exercise is a polypill. We don't realize it.
It's also, I think, like not only moving the spine, but also stretching it out and keeping it limber is super beneficial. Even if you have a day of stretching because you don't feel like exercising, it's still beneficial.
That mobility and flexibility absolutely is, especially for those days when you're feeling like I need to move. I know how important exercise is going to be. I can't really even fathom doing, my heavy leg set or the endurance run that it was in my training schedule. Just move your body, get the lymphatic drainage, get the synovial fluids into the joints, and get some, fresh blood flow going into the different tissue structures. We've got soft tissue, fascia, we've got nerves, we've got myelin sheaths around the nerves themselves. There's so many different areas that we can impact our health with exercise and movement, and it's not just about strength and muscle. So many.
It's incredible.
Our bodies are fascinating, and that's why I love it. There's so much.
Wow, that's actually, I've just learned so much now.
Oh.
You chat about specific areas that impact female wellness with regards to pelvic floor. So your breath pattern, posture, thoracic rotation, IAP, which I wasn't sure what that was, bowel movements, and trauma. Can we sort of unpack all of these a little bit just to understand that better?
Yeah, so I think I'll start with IAP, which is intra-abdominal pressure. And that's the pressure within the abdominal cavity that's generated by the interplay of the diaphragm and the abdominal muscles and the pelvic floor. So if you think about your core canister, everyone knows about the core, but what is the core actually? And it's made up of our diaphragm that sits up the top, your pelvic floor that sits down the bottom, mostly your transverse abdominis, which is your deepest abdominal muscle that wraps around your body like a corset or a cummerbund. You've got your multifidus that runs up and down through those intervertebral segment spaces, and it creates this canister of support through the center of your body. So when you're inhaling, your diaphragm, which is dome-shaped, descends down, flattens and descends, so it pushes pressure down into the rest of the abdominal cavity. So if your pelvic floor doesn't have extensibility whilst you're taking that inhale, it can lead to those sort of incontinence kind of issues, pelvic floor dysfunction, those sorts of things. So we want to have a nice intrinsic relationship between that diaphragm and the pelvic floor to help manage pressure in that abdominal cavity, which ties in all those things of pelvic floor dysfunction, breath, posture, thoracic rotation, to make sure that we can get that extensibility into the rest of the musculature to allow for all these things to work so nicely together. And it's pressure management, I think, is something particularly in the pre and postnatal population that we focus quite a lot on, because it's changed so much during your pregnancy and postpartum period in a relatively short space of time. Although I think a mom at 40 weeks is going to tell you it hasn't been that short. It's been a long journey during pregnancy. But your body has changed so much, and you need to sort of relearn how to manage that pressure in your system to get that that foundation of support that we've just spoken about established, so that you can have efficient movement, that you can prevent things from becoming a problem later on. Yeah, pressure management, intra-abdominal pressure, thoracic rotation. If we're sitting behind a desk, it's a move that I love to give everyone, actually, so that we can, we tend to lock up a lot in that thoracic spine, and usually a lot of people will come in with lower back pain, but the problem actually isn't there. That's the symptom. It's telling you that something else is going on. So as a practitioner, I like to look further than just the symptom that the patient walks in with. So, again, they might come in with a certain problem, but what else is happening for them to have come to you at this point with that discomfort? And by and large, you'll usually find that there's something else going on in the rest of the kinetic chain to create that kind of symptom for them. Then in terms of trauma, it's something that I'm still learning more about, but I really do believe that our body can emotional things can manifest themselves as physiological problems. So, just if we all know about fight, flight, freeze, and fawn, that's your central nervous system coming into play in terms of what kind of level it's working at, and your body will have a different response to trauma based on which neural pathway it's kicking into. So, if we're staying in this heightened freeze state, your body's not going to be able to work efficiently. It needs to be working in all ranges of contractibility, extensibility, those sorts of things. So it's, I think we take our bodies for granted, actually, because
We
maybe
really
just from...
do. It's terrible.
Yeah, there's so much to it.
Incredible. The sensitivity also. I mean, the way that you've been describing how I think we have been taught at school to think of things separately, like systems, but actually everything is completely interconnected, working together, the sort of messaging system.
Absolutely. So there's different schools of thoughts of holism or reductionism. So from an academic point of view, we are taught very much from a reductionist point of view to try and get as much information about this specific thing, which is great to have that theoretical knowledge, but our bodies work together. It's this whole integrity unit. It's it's this beautiful symphony of things going on synergistically and simultaneously. And I think it's wonderful to have that really focused attention to detail if you can, but let's not forget about the bigger picture when it comes to our bodies and health and wellness.
Especially, as you say, if you're trying to diagnose something and you realize that your body is overcompensating in a certain area, but the primary source is actually somewhere else.
Absolutely. Where you think it is, it actually ain't.
Okay, now there's a word that I don't know if I'm going to be able to pronounce. Can you tell us about diastasis rectum abdominis?
Sure, DRA.
I should have just said DRA. I don't know why I didn't. In the pre and postnatal woman. And then I think maybe how we can prevent this and treat it, or if it's already sort of set in, well, what do we do?
Sure. So it's a very topical subject and has been for a long time because the sort of school of thought around it constantly changes. And DRA is a naturally occurring phenomenon in the prenatal population. It has to happen. What it is a widening and thinning of a tissue called the linea alba, which is a sheath of tissue between the two rectus abdominis muscle columns. So those six-pack muscles, if they're in there somewhere, there's a tissue called the linea alba, and that widens and thins out during pregnancy as your bub grows to accommodate for the size of the baby. And it has to take place. For our prenatal population, they might see when they do any sort of trunk flexion movement, so leaning forwards from a lying back position or reclined position, they'll see this sort of midline ridging or coning and doming, as we call it, taking place. And there's always been a lot of fear around having a DRA because of the thought that it feeds into things like pelvic floor dysfunction, it's going to damage your abdominal muscles, whatever the case may be. But I think mostly it's an aesthetic discomfort. It does maybe some people think that it might lead towards more hernias as, umbilical and inguinal and those sorts of things, because again, it's about pressure management. But I think that what we have come to learn now is that it is not a death sentence. You can still exercise with a diastasis. You can still function with a diastasis. You can help improve the tensioning of that linea alba tissue. You're not necessarily going to get rid of it completely. There was a lot of focus on trying to close the gap, try and bring those two rectus columns back together with certain exercise modalities, but we've also come to realize that the depth of that tissue when you're doing an assessment for it or trying to intervene is just as important, or if not more important, because that tells us that we're getting better tensioning through that linea alba and improving what's called the distortion index of the linea alba. So it can be more functional. So if this tissue is all loosey-goosey and doesn't have that tensile property, it can't transfer those forces and load throughout the rest of the system for it to work in that beautiful synergistic orchestral way that it has been designed to do. So I think the conversation has now changed towards more how can we create a functional diastasis if you've got one, because I want to say 100%, but I mean, probably 80 to 90% of your pregnant population is going to get some degree of a diastasis. It can happen, quite high up at the level of the sternum, just above the umbilicus or your belly button, and or below. It can be the entire length. Standard, what's considered not clinically relevant is something less than 2 centimeters width in terms of the space between the two rectus columns. But it's something that even non-pregnant people, nulliparous individuals, so people who've gone through rapid weight changes, some people are just genetically predisposed to having something like this. Gents who've got that big Weber sometimes also are, going to have a bit of a DRA as well. So it's something that can definitely be worked with. It can feed into that whole pressure management system that we were talking about, but it's something that I'm on a mission to try and educate people to say that don't fear it. You can work with it. You can have a functional DRA as well, whether it's during your pregnancy or after your pregnancy too.
I'm going to do the abbreviation. A lot of moms suffer from PSD, but not the pubis. Yeah, what is this and how can we improve the condition?
Sure. So pubic symphysis dysfunction or symphysis pubis dysfunction, it's the same. It falls within the pregnancy-related pelvic girdle pain. Again, another umbrella term for all the different things that can take place. But the pubic symphysis itself is this fibrocartilaginous joint space at the front of your pelvis where the two sides of your pelvis connect. And it's not really meant to have too much movement. But because of all the changes that our body goes through during pregnancy, from a biomechanical and an endocrinological point of view, you've got all these hormones coming in, preparing the pelvis for birth. There's a little bit more movement going on in that structure. You also have the sort of positioning of your pelvis changing as the bub grows. Your center of gravity shifts forwards and down, so your baby's head is also quite likely going to be pushing down on that pubic symphysis a little bit too. And it really can just create a lot more shearing forces at the front of that pelvis there, which can be really, really uncomfortable. So you might find your moms with this kind of waddle gait. They don't want to have too much single leg forward motion going on. So the telltale if someone has got a PSD or SVD is that waddle kind of gait happening, and it's so uncomfortable. It doesn't alleviate. It's there consistently, and it really affects your activities of daily living. Walking up and down stairs, getting in and out of the car, getting your clothes on can be challenging because you tend to stand on one leg, and it's that single leg stance in a split stance position that can really, really aggravate your SVD conditions. Whilst you're in the thick of it in pregnancy, it can be very challenging to sort of treat and mitigate and manage. But ideally what we want to try and do is improve what's called force closure. So our body relies on different ways to create stability. So we have form closure, which is really the intrinsic stability that we get from our skeletal structures. But then there's also force closure, which is the active co-contraction of tissues to create stability across a joint or a space. And so, force closure is something that we tend to lose a lot with all the stretching and growth that goes on during pregnancy. But if we can get our active tissues to try and create a little bit more stability across those joint spaces and through the beautiful slings that our body is designed to have, it can help. It's not necessarily going to completely rid it, but there's ways, and little tips and tricks that we can show you if you come to my practice. I think a few things that you can do if you've got some SVD is if you're getting in and out of the car, don't swing your one leg out, try and get both legs to move together. Try and sit down to pull on a pair of pants instead of standing, because that single leg stance is going to give you some issues. Try and make sure that you are wearing supportive clothing if you can. And it's a horrible one. Sleeping on your side with a pillow between the knees, those sorts of things can help. But again, this is one of those areas that you really want to try and nip it in the bud as soon as quick as you possibly can. You don't want to wait for it to get so debilitating that you can't even get to a practitioner to have the intervention to help you with the symptoms, because it can be so life-affecting. I've seen moms walking in with crutches or needing to get a wheelchair kind of thing because it's so awful. And it can alleviate almost immediately after delivery, if you're lucky enough. Some people do have lingering discomfort after delivery too, but I would say to those moms who have gone through that is to really see a bio or a physio with women's health interest, and really see what's happening from a biomechanical point of view and what interventions can be prescribed for you specifically for your lifestyle and for your specific outcomes, so that you can be in a better supported state going forwards.
This has brought back some awful memories.
Oh
And
no,
I don't even think
sorry.
I had that. No, just being sort of 9 months and that feeling of like, there's nothing like it. It's indescribable, but yeah. Anyway.
No, it's awful. Again, women are amazing. We just deal, don't we? We're like, oh, it's just pregnancy. I've got to carry on. I've got to focus on so many other things. But it's so important to make sure that we're looking after ourselves as well. So to all the up and coming moms, please don't suffer in silence. There are people out there that can help you.
We love the fact that you regard exercise as medicine. Holistically speaking, how does exercise impact a perimenopausal/menopausal woman? And what, in your opinion, are the 3 vital areas that it assists with?
So peri and menopause are, something that I'm still learning a lot about myself. So I would... I probably do need to educate myself a little bit more on it. So obviously it is knocking on the door coming into my life, so I can't avoid it any longer. But I think that, with the limited knowledge that I have around it, in terms of how exercise can help, obviously that mental well-being is so vitally important. Exercise does so much for your mental state, but helps with the management of anxiety, of your mood. It helps with resilience to kind of get through these tough times. Helps with cognitive function. So I've heard a lot of, the brain fog that comes with it is also quite frustrating. And of course, exercise helps with your sleep too. Can only set you up for success in terms of your mental well-being. So I think that's probably one area that exercise can help. And then bone health, your estrogen levels drop, you're more predisposed to bone density issues. So you want to avoid heading towards osteoporosis. Resistance training is hugely important in terms of bone health, making sure that you get the right dosage and load and type of resistance training for bone health is quite important during that stage. And then your cardiovascular health. I believe that there's an increased risk of cardiovascular disease once you go through menopause. So we know without a shadow of a doubt that exercise can help improve what's called endothelial function. So that's the lining in your blood vessels, and to help them expand and contract and manage your blood pressure. So if you can get, again, the right dosage of exercise from an aerobic point of view too. So it's not just about the resistance training. It's not just about the aerobic components. It's got to be a management of all of it together. I would imagine that those are 3 areas that can be benefited from when you're going through peri and menopausal stages, if you incorporate exercise into your management. And I think it's so important to make sure that we are doing tangible lifestyle modifications to help us through these stages, because we're so quick to be like, oh, I need medication, I need this. And yes, I'm sure that there is a stage for that at any given point, but let's exhaust all other conservative treatment strategies if we can. It's something that we can do for ourselves. You don't necessarily have to pay to do exercise. We can just do it at home. You can go for a walk. You can go for a run. You can do things that are within, your reach to help me.
Absolutely. Yeah. I think prevention is always the best option. Okay, perfect. So if someone's been watching this and they want to get hold of you, they want to find out more, they want to come visit you, how does one get hold of you? I know you've got an Instagram account.
Yes, absolutely. Just send me some of my contact details on Instagram. My website is still being made, something that is always on the go. That perfectionist side of me needs to be perfect. But yeah, just send me a message on Instagram, or my email address is on there as well. And I think my work number might actually be there too. But yeah, just pop me a message and then we can get in touch.
And your email.
Great. Perfect.
Okay, thank you so much for joining us. It has been very, very eye-opening. I've learned so much today. A bit of pronunciation work as well.
You and me both, don't worry.
But thank you so much. Yeah, it's been amazing.
Thank you so much for the opportunity. I've loved chatting.